Good morning, and thank you, Leslie, for the kind introduction. And thank you to all of the youth-serving professionals who are spending their holiday weekend here learning how we can work together to create safe, inclusive, and supportive schools for LGBTQ youth. As the proud spouse of a middle school teacher, and in my role at CDC in the Division of Adolescent and School Health, I understand that schools and the people who work in them have the ability to shape the lives of young people, not only during their adolescent years, but long into adulthood. Schools can be a place of learning and growth, but they can also be a place where the youth experience stigma and bullying and don't get the inclusive education and support that they need. Because of your commitment and what you're learning at conferences like this one, there are LGBTQ youth who will grow into adults who are healthier, more resilient, and have greater opportunities. And we thank you for that. Over the last few years at this conference, I've shared CDC's research efforts to understand what's happening in the lives of LGBTQ youth. Last year, we released a second round of data on sexual minority youth from the Youth Risk Behavior Survey. This is a nationally representative survey of high school students that's been collecting data on their behaviors and experiences for the past 30 years. But only since 2015 have we included questions that ask students about their sexual identity and their sexual partners. Seeing the second round of data, overall, we see that sexual minority youth were facing the same kinds of issues in 2017 that they were in 2015. Higher rates of bullying and assault, resulting in mental health issues and suicidal ideation at higher rates than their straight peers. However, while experiences vary widely across LGBTQ youth, we've also been able to identify some good news, like learning that the HIV prevention messages that we provide to young men who have sex with men are working, and that young men who identify as gay are most likely to be tested for HIV, and that's great news. We also recognize the importance of expanding our data efforts to capture the full experiences of our youth, including those who identify as transgender. And so this past year, for the first time, we completed a pilot study in 19 locations across the country that included a question for students on whether they identify as transgender, understanding how important it is to let people know that they count. While this isn't a perfect question and it isn't national data yet, it does give us a first glimpse. We found that nearly 2% of high school students, that's 1 out of 50, identify as transgender, and that those students, like other sexual minority students, experience higher rates of school-based violence than their cisgender peers. We also found that more than a third had attempted suicide in the past year. We must do better for our LGBTQ youth. The good news, please. The good news is that we know what LGBTQ youth need in their schools. They need sex education that includes them. They need access to health services that affirm their identities and make them feel welcome. They need schools with safe spaces, safe adults, GSAs, and anti-bullying policies that explicitly protect LGBTQ youth and professional development for educators and personnel. And that's where you all come in. These are the things that you can ask your schools to provide, and we at the Centers for Disease Control are here to support you. I'm so proud to be here, knowing that everybody here shares the commitment to do better by our youth. So enjoy your experience here at Time to Thrive. I look forward to talking with you and to learning from many of you. And now, it is my pleasure to introduce our next speaker, Thomas Davis. Thomas is the creator of the Catharsis Project, a growing organization committed to creating safe spaces for young people living with and affected by HIV through dance, written and spoken word, visual art, and film. He has spoken both nationally and internationally about his story to fight to combat HIV stigma. Thomas is a former HRC Youth Ambassador and an HIV 360 Fellow, and he is currently working as Program Coordinator for the Black AIDS Institute. So please help me welcome Thomas to the stage.